If you are experiencing pain on the head of the penis after having had a circumcision, you may want to watch this video because I will explain why this happens, how long it lasts, and what to do to manage it properly. My name is Giangiacomo Landini. I'm a consultant urological surgeon in London. Circumcision is the removal of the foreskin, and that is indicated when the foreskin is too tight. So in many cases, the chances are that the foreskin is never able to completely expose the glans penis. What does this mean? It means that for the entire life, you might have had all the stimulation filtered by the foreskin that was placed in between. And I'm talking about simple things, like for example, the fabric of your underwear and the friction during the movement. So what happens now? Now, the very same system that was elaborating those signals and understanding that something was happening in relation to the touch, to the friction, etc., is now obtaining a lot more of information because there is not the filter anymore, because there is no foreskin anymore. So it's quite normal that your brain reads this incredibly stronger amount of signals as pain. So usually what you are experiencing now is hypersensitivity. That means your brain is giving interpretation to the new reality using the old way of elaborating them. Hypersensitivity after a circumcision is the norm, so you do not have to worry if that happens to you now. Especially this is the case if your glans penis was always covered by the foreskin and if you actively never had any stimulation from outside without the filter of the foreskin. What I usually say to my patients is that the hypersensitivity has a first acute phase where immediately after the operation you may struggle coping with standard activities and can be quite bothersome, and I totally understand if that's the case. But it normally lasts for up to 1 or 2 months, and then it goes to a settled phase where the glans gets covered by a thicker skin similar to the rest of the body rather than a very thin and fragile mucosa, and that will represent the first barrier to the stimulation. Moreover, there is a process of what is called neuroadaptation. That means the recalibration of the nerve system in order to have a new set of benchmarks, a new set of standard values about the sensitivity that it must have. So basically we are able to recalibrate to the new reality, especially if you had the glans covered for a long time or for the entire life. And if it was very sensitive to start with, it may last for much longer, up to 4-6 months. I had patients that had a very long recovery process despite surgery having been very well healed in a few weeks, and the neuroadaptation plus the resurfacing of the glans penis only led to their comfort after around 6 months. So if you are in pain, what you can do for the time being is to utilize some moisturizer or, for example, a little bit of Vaseline to make sure that the head of the penis is always moisturized and hydrated. It will dry up at some point because that is part of the healing process, and it will become, as said before, a tougher layer of skin-like tissue rather than a mucosa as it is now. But that will require some time, and in the meantime, if you keep it always moisturized, that will help also with your pain. You need to make sure you don't use any aggressive detergent. Actually, best practice would be to avoid soap at all for the penis. You can use some emollients or as a soap substitute, for example. Also, the underwear, if it is too tight, will likely have a lot of friction, so it's best to use some soft fabric and loose underwear. The numbing cream is an option that is reserved to the moment where you can't really cope with the uncomfortable feeling anymore. So first of all, it is a prescription medication, so you will need to speak with your GP or your surgeon about it, and you need to make sure that you don't overuse it, because otherwise you will never promote the process of readaptation. And if you overuse a numbing cream, you have the risk of irritating the glans penis, and you have the risk of not being aware of some irritation that happens, or for example an excess of friction, properly, because you don't feel anything. It's anesthetized. What you can do to promote precisely this readaptation is to start giving some signals to your brain, and you can do so using again a moisturizer or Vaseline or some silicone-based intimate lubricant, or some of those silicone-based gels that are used for the scar healing processes. And doing so gently, you can rub your thumb on top of the glans penis, so that you start giving signals to the brain that will eventually elaborate, and you start and continue the recalibration process, that is the neuroadaptation. You can start 1-2 minutes once or twice a day with a very gentle, very soft touch, and then you can continue with a bit more strength week by week. But that's just if you are certain that you're not causing any irritation, if there is no redness, if there is no pain. If in case something like that happens, it's better to stop and to talk with your surgeon. In fact, if you have worsening pain, if you have some problems like redness, some swelling, if you have fever, if you have some awkward shape of the penis, or especially if the wound is giving some material that doesn't look quite right, at this point in healing, you should have the wound that is completely sealed. So if that is not the case, stop any manipulation and speak immediately with your surgeon. So, in summary, if you're experiencing pain after a circumcision and you had a very tight phimosis, that is expected, highly likely, nothing is going wrong, and this is the normal post-operative time. Hypersensitivity is extremely common and should not be a major concern. It is expected that you will arrive in normal conditions to a position where you are fully comfortable, but if this is not happening, or if you are concerned about your specific condition, best to speak with the surgeon that operated you. If you did enjoy this video and you liked watching it, please click like, and if you want to have notifications when I am preparing a new video, don't forget to subscribe to my channel. Keep in mind, these videos are based on real patients' questions, so they are born out of questions that patients do me a lot of times in clinic. That means if you have your question, feel free to write it down in the comments, and I'll do my best to make sure it is answered to.